Good morning, good afternoon, good evening to you, wherever you are joining from for this session. We thank you for joining this session. And so far we have about 30 plus on the call. So we'll begin with the initial intros whilst we wait for others to join us. So we are happy that you've joined this Wash and Health session. You are participating in this Wash and Health session, aligning Wash and Health for better well-being. It's a precursor to our Wash Connect session that we'll be having at the All Systems Go session. My name is Vida Duty. I work with IRC and I'm based in Ghana. We have an exciting session planned which will explore the relationship between Wash and Health and discuss entry point for closer alignment. Following this, the presentations that we'll be having from Lindsay, we will hear reflections from two colleagues who have worked within the nexus of Wash and Health. Dr. Mary E. Asignon of Ghana Health Services and Mr. Kofi Abram of PATH, also from Ghana. We will then have some time for an open discussion amongst participants, learn about opportunities to take this conversation to the next level. We do really value your input, so we hope that you help us to make this a very interactive session. Before we start, I want to share a little information about Connect Hub. The pursuit of our purpose, IRC understands the importance not just of the individual wash system, but of the interconnectedness of the different systems that surround and connect with water, sanitation, and hygiene. Much of our work over the last decade, we have focused on defining wash services delivery from a systems perspective. It is now time to reach out of wash silo and actively engage with other systems, health, education, economic development, climate, engaging them in our advocacy and learning, supporting them in this. And that is why this session is so important for us. And everybody on this session, I believe, also wants to engage in this topic. The aim is to build alliances and mobilize broader coalition nationally, regionally, and globally. This is the rationale for the Connect agenda that lies behind our Connect program and in the upcoming All Systems Connect Symposium, taking place in The Hague in May. We will have a chance to speak more about that later in the session. I hope that we've all registered for All Systems Go Africa, All Systems Go Connect in The Hague in May, and in May, all roads to lead to the Netherlands. So we look forward to connecting and continuing the discussion. For today, we would have the first presentation by Lindsay Danny, IRC Health Association, leading the Connect Health portfolio, who will present on the Wash Health position paper IRC recently published. Lindsay, at this stage, I hand over to you to share what in the position paper. Thank you.
Thank you so much, Vida. And it's a pleasure to be with you all this morning and this afternoon, this evening, wherever you are joining us from. And as Vida said, the goal really here is today to talk about the alignment between WASH and health. I know many of you I'm probably speaking to are already converts. So really what I hope we can get out of today is a discussion about first, the key entry points that we've identified that may be valuable for us to build greater alignment, but then also a conversation around what's next. How do we build an agenda and how do we actually move this forward? Certainly, this is something IRC would like to do with our partners. So we invite you to this conversation. But I'll first start with a quote from Dr. Tedros, the Director General of the WHO. If you can't do the basics, forget the rest. Prevention, prevention, prevention. This is really key to public health and certainly and part of the ethos in terms of why we do WASH work. Certainly it is critical for providing health and well-being. And so I want to talk today about what it is we're trying to achieve with our partners here. So a bit of background, despite the interconnectedness of WASH and human health, it seems that a divide has grown between the two sectors. This is something we certainly talk about maybe informally amongst our colleagues, something that we may bemoan as not being part of the conversation with our global health counterparts. And though experts on both sides may agree that we share common goals, in practice, we've sort of developed these silos that operate largely independent of one another. Though we may have projects that have elements of this, we really don't see a broader overarching approach to ensuring that WASH is a critical component to developing safe health programs. However, it's generally agreed that this false divide does not serve the greater good, and closer alignment would be beneficial to achieving this common goal of health and well-being. So with that in mind, we wanted to pursue an understanding of how we would move forward and bridge this gap. So what is the relationship between WASH and health? Again, I'm preaching to the choir here. Certainly this is all about disease prevention. And we have seen this in various forms. The F diagram is one way in which we demonstrate the role that WASH plays, whether it's a water source, sanitation facilities, the use of hand hygiene. All of these are types of mechanisms that can provide barriers to prevent the spread, in this case of in the fecal oral cycle. So this is one example. I think that COVID-19 really emphasized for us, though, that it's not just about waterborne diseases. There is an incredibly important role of water, sanitation, and hygiene when it comes to other types of disease prevention, whether we're talking about COVID-19 and preventing the spread there, or if we're talking about other routine infections that might be spread, for example, in a healthcare facility. So this is one diagram, but keeping in mind that we're really talking about the broader picture of disease prevention here, and WASH being a critical tool in the toolbox that public health provides. It's certainly not the only one. We know the value of things like vaccines, but it is very important. And we've seen that all the way back from things like the Broad Street pump in London stopping the cholera outbreak. So water supply, sanitation, and hygiene interventions are mechanisms which can interrupt the transmission of disease and therefore protect human health. And one of the things I think that is challenging when it comes from us trying to partner, us as WASH practitioners, trying to partner with our health colleagues, is often that WASH being a mechanism or a tool, and we're talking about individual diseases, there seems to sometimes be a mismatch. We're not a disease vertical. And so where do we fit within this landscape of the global health space? And so we put together a scoping on the WASH and health nexus to better understand. This is our own personal mapping. You might think about other components or other spokes of the wheel that might be part of this, but just to understand where we would even start this conversation, sat down and did this mapping exercise and could see, of course, though, when we talk about WASH as a critical component to preventing the spread of disease, we know that that plays a role in things like diarrheal diseases. Some neglected tropical diseases, for example, have a preventative element which would be provided through WASH. Sexual and reproductive health, when we look at menstrual hygiene management, and then also looking at maternal and child health. So we went through this process and started to look at the full picture. And in the background of all of this are some of these overarching topics that are bigger than one individual disease vertical. That's things like health system strengthening, universal health coverage, primary health care. Some of these may sound familiar to you if you've worked with the health sector. And then there's these sort of adjacent topics that aren't necessarily directly global health, but certainly are going to play a role as we scope across WASH and health. That's topics like nutrition, which already has the conversations about their nexus with health, climate change, gender. All of these are playing a role. And so to better understand how we would approach the entry point here, we sat down to think about, is there one individual spoke of the wheel that would be most effective to carry these conversations forward? And we'll go more into that in a moment, but the spoiler is we think it might be more valuable to talk about broader issues rather than choose one of these individual because you end up in another silo. So this was the first exercise we undertook. And then thinking about the big mapping, there is also a reflection on the barriers to alignment. What was preventing WASH and health from working together as effectively as we could? So some examples came from a Kaiser Family Foundation roundtable that happened just before COVID, right in the height of the advocacy for WASH and healthcare facilities. I believe this was about 2 weeks after the World Health Assembly resolution. We put on this session, and partners from both WASH and health were in the room, and they came up with a list of some barriers. I'm not a fan of only focusing on barriers. I think we should be really identifying solutions, but it's certainly valuable to understand why we may be limited in our success to date and make sure that the solutions we develop are taking these into account. So types of solutions that were listed were things like lack of strong indicators for measuring WASH's impact. That's a whole topic in and of itself, but that was listed. Ineffective emphasis on sustainability perhaps would be a challenge. The possibility of too many entry points. So similar to that image I showed before of all the spokes on the wheel, was it actually diluting our efforts to support global health through WASH? Substantial funding needed to invest in WASH as compared to perhaps some of the other maternal and newborn health investments. And then challenges between coordination between WASH and global health, particularly as the growth of these two entirely separate sectors that sometimes pull together different skill sets. In WASH, we often have behavior change specialists and engineers, while in global health, we may have people with more of a medical or public health background, and you don't necessarily speak the same language and are working in alignment in that sense. So based on these barriers, based on these scoping exercises, we set out to put together this position paper. And the goal of the position paper was to identify entry points that the WASH sector could leverage to work in closer partnership with our global health colleagues. These entry points, once these entry points were clear, we can then begin to develop an agenda aimed at greater alignment and hopefully do this not only amongst ourselves, but with you all as partners in this process. As methods, we reviewed documents, interviewed global health and WASH experts. Some of you are on this call, and we were looking to identify those entry points that might be effective. And then the output is taking these into account. We can then have areas for advocacy based on this information and certainly start to develop more robust conversations rather than speaking kind of broadly across these two topics. So came upon 3 key entry points, and I'm going to go into each of these. But the first is robust, high-quality health systems. The second is disease prevention, which I've been noting a number of times in this presentation. And the third is green, climate-resilient health systems. I'll go through each individually. So when we say robust, high-quality health systems, really we're talking about the fact that WASH is integral to ensuring that health systems are able to provide safe, quality care and prevent illness from needing care in the first place. This is capturing topics like health system strengthening, primary health care, and universal health coverage. And one of the things I think is critical when we think about high quality health systems is certainly the service delivery component, so ensuring that WASH is available where you receive care, but it's really taking it a step beyond that and thinking about the role WASH plays as a preventative mechanism, and seeing that WASH is critical in communities, in schools, and other settings. And because the WASH sector is often set up more by setting than it is about specific vertical disease topic, I think it's helpful to think of this specific topic as being capturing all of these contexts. The second is, of course, disease prevention. And of course, WASH, along with other preventative mechanisms like infection prevention and control, or IPC, and vaccines, are critical for controlling a myriad of diseases. This could be cholera, COVID-19, or even the emerging threat of antimicrobial resistance, or AMR. And subtopics underneath this include public health emergencies, pandemic preparedness, and global health security. And if you think back to that scoping exercise that we undertook, many of these topics fall under this disease prevention. And I think the reason we thought about it in this sense is that with this concern of having so many entry points, if we only choose diarrheal disease or we only choose NTDs, we may be missing an opportunity to work more broadly with our health partners when we think about our advocacy and thinking about how we can build greater alignment. There is, of course, in the health sector, this discussion around disease verticals and is that the most effective way forward? I don't think we'll see the dissolution of disease verticals anytime soon. I think there's obviously reasons why people work in very specific areas like HIV, but I do think there's a growing understanding that we need to talk about the health system more broadly. And prevention is one element that has typically been less emphasized compared to perhaps a curative approach to these issues. So I think we have a large role to play in ensuring that WASH is part of these conversations of preventing cholera, et cetera. And some of these groups already do have a strong WASH group to them. So if you are familiar with the Global Task Force for Cholera Control or the NTD NGO network, they both have WASH working groups as part of them. So we already see that from a maybe disease vertical perspective, how do we make sure it's part of the more overarching conversations, particularly as we saw in perhaps the response to the pandemic, whether or not WASH was really set up and prepared to be part of that response, which I would argue had not really taken place. And then last is green climate resilient health systems. And this is certainly an area that's being defined, and that's actually the reason why I pulled it out as something separate. Certainly a climate resilient facility should be a robust health system, but I think we wanted to make these separate and really emphasize because the health system is a little bit newer in the conversations around climate resiliency. If you remember, COP26, I believe, was the first time they had a health program. And really there's been a ramping up in the last couple of years around climate change and health. And because this is a newer area, I think it's a really ripe opportunity for WASH colleagues who perhaps have more expertise, experience working in the climate resiliency space, having these conversations over many years, to step forward with that expertise and be on board to really drive that forward and really be seen as a valuable asset to build that alignment. So I want to look at that as something separate that eventually may come into the idea that robust health systems are climate resilient health systems, and we merge that into one conversation. But I think for where we are at this current stage, I think it's really important to think about climate resiliency in its own space in those own conversations. There's a couple of key takeaways I wanted to raise here before we turn over to our reflectants. So there's a significant overlap between WASH and global health in the scope of work, and we share a common goal of protecting and improving human health. And this is agreed upon by both sides. Many of you, I'm sure, have been part of these conversations, if not with me, certainly with your colleagues. And we identified 3 entry points for alignment. None of these are particularly mind-blowing. This is not talking about things that you aren't already aware of. However, I think it's really valuable to emphasize taking these approaches because then we can be much more effective and much more specific in the ways that we engage both through an advocacy perspective, but also as partners for implementation and developing of policies. So these entry points are robust, high-quality health systems, disease prevention, and climate-resilient health systems. And I think there's an opportunity for the WASH sector to bring its comparative advantage to the fore and engage in these conversations about how we work more effectively in the future, particularly as we are at this inflection point of COVID-19, the health sector really reflecting on what's happened over the last couple of years. How do we do better moving forward? How do we build stronger systems? WASH can be a critical partner for ensuring that we are prepared to respond, prepared to provide safe quality care at all times for all. So with that, I'd like to go ahead and stop, and I'll turn back to Vida so we can hear from our reflectants.
Thank you very much, Lindsay, for that great presentation and all the insights that you have provided, giving the frame for our conversation this afternoon. Thank you. I saw that others were asking for how to assess the paper. It's been responded to, so please check the messages in the chat and you'll find answers to that. We're going to turn to two personalities that have really been at the forefront and working to bring this connection in practice. We have with us Dr. Mary Ashignon, who is the Deputy Lead and Director for Quality Assurance within the Ghana Health Service. I've worked extensively with Mary, and I see her as the main person that is trying to pull the WASH and the health together within the sector. She herself is a medical doctor, and so she's had that experience of being out there in the field, and now she's at the policy level and trying to pull all these together. Mary would like to hear your reflections, particularly on the takeaways, whether from where you sit, indeed, you also agree to the fact, and I know you agree to that fact, that there's a strong interconnection between WASH and health. Lindsay has shared some experiences about 3 key entry points, your perspective on that, and how you see the WASH sector connecting effectively with the health systems that you have in driving this agenda that we are talking about.
Okay, thank you so very much, Vida, for the kind introduction. It's a pleasure to join this conversation to talk about the work we've been doing on WASH in healthcare facilities with our partners in the WASH space, with over 20 of them, including IRC and PATH, who are also on the conversation today. So Lindsay has given a very comprehensive presentation on the link between WASH and health. And I agree with her so very much. I would start off from where she has ended on the takeaways. And I would say that the takeaways really resonate with us because you know that Ghana's health system is not very different from the health systems that most of us on the call come from. So in terms of the 3 entry points that Lindsay talked about, she talked about high quality systems, disease prevention, and climate resilient health systems. I would say that in our program, we have had the experience on all these 3 entry points, and we think they are the best that we can identify at this point to start the conversation with. So Lindsay talked about how WASH is the foundation of infection prevention and control, which is absolutely true. Why it is also critical for quality of care, especially because safety and effectiveness are dimensions of healthcare quality. And you cannot really have safe health systems without WASH in healthcare facilities. If you look at the WHO framework for health systems responsiveness, it has 8 elements. And one of the elements is availability of social amenities, and that is mainly WASH. So the conversation about primary healthcare, there are components that are WASH. So you see that WASH and health have a very long-standing friendship. And especially from the example of the Broad Street pump that Lindsay talked about in the presentation. I would like to then go to the definition of a health system, which we all know is all actions, individuals, and organizations whose intent is to promote, restore, and maintain health. So now when we look at WASH, we see that WASH really fits into this definition of a health system. So actually, whenever I meet with VIDA and we are talking about WASH in healthcare facilities, I always say that outside health systems, WASH is WASH, but within health system, WASH is actually health. So for us, aligning WASH and health is a journey that I think it's very, very feasible. Maybe we should actually be talking about realigning, because actually we have a long history of WASH and health and sanitation. So really we have a lot of opportunities for us to drive the agenda of aligning the WASH sector and the health systems to come together more closely than we had before. And this is even more important in the context of the many outbreaks that are springing up in health systems these days. And we can't break the chain of infection without WASH. So this is critical. Now, let me talk about how I think we can do this a little more faster, because really, if we have to go at the current rate that we are going, I'm not very sure we are going to meet the SDG goals and targets. So it means we really have to go faster. And I think this was also underscored at the All Systems Go Africa event, which was held in Ghana, that we really have to move at a faster pace than we are doing currently. And one of the first things I was reflecting on is that we need to be asking the right questions and getting answers to them. And in getting answers to the right questions, we need to look at the data that is available to take decisions to make sure that we are aligning WASH and health. There are so many countries across the world whose health systems do not have data related to WASH. And so how do you even define the extent of the problem and what gap there is to fill in terms of alignment? So data is a very critical component of aligning WASH and health. And closely related to data is research. So research will help us to understand what are the dynamics if we really want to align WASH and health. Sometimes we feel we understand the dynamics, but it's not always clear. I give an example about community engagement for WASH solutions, where some partners went to situate a pump near a borehole near a community that they thought did not have access to safe water. And within a few days, the community vandalized the borehole, the facility. And the reason, I mean, to our wildest imagination, the reason is just that usually these parents were living in single rooms. And so if they wanted some privacy to themselves, they would send their children to go far away and search and fetch water. So in their interest, they didn't want safe water close to them. But that is a dynamic that you can actually never understand if you don't go engage with the community and try to understand some of the factors that drive people's behavior in terms of WASH. And so that is very critical. And if these people don't have WASH, certainly they are at high risk in this community for cholera and other infectious diseases. So research and data is very, very important. Now, when it comes to workforce, we need also capacity building. And usually when we say capacity building, we quickly say training, but it is not just training. It is also the institutional capacity to even support the workforce to do what they have to do in terms of WASH and health. And that also means a mindset change and a behavioral change approach, because we know how technical people like doctors, nurses, pharmacies, and other healthcare workers, we know how they tend to think of other programs outside health. And I relate this to the comments from Vida when she was introducing me, and she said, I am a doctor and now working in policy, and she wants to see my experience. I remember doing a presentation in a high-level meeting to our managers to sensitize them on WASH. And when we finished, one of my senior colleagues walked up to me and said, "Oh, Mary, so this WASH you have been disturbing about is actually just water and toilets." So, and I was like, yes, it's actually water and toilets, but imagine that you woke up this morning and you didn't brush your teeth. and you didn't bath, you know, and you didn't have toilets to ease yourself if you had, you know, diarrhea, how would you have come to work? So as simple as it sounds in the mindset of the health workforce, it is the most critical thing. And I think that is a mindset change that we need to drive. It's a paradigm that we really have to work on. Vida, please let me know when my time is running out. Then the third thing we have to be looking at.
You can be wrapping up if it's okay with you.
Okay, fantastic. The third thing that we need to be looking at is actually who has to be at the table when we are going to align WASH and health. Because if you look at WASH and health, I remember the patient safety conference, the national conference we had in Ghana. We always have WASH as a sub-theme because it's the foundation of patient safety. And the panel was made up of 6 of our development partners, UNICEF, WHO, IRC, CRS, and they were all talking about where is Ghana Water Company? Where is community company? So you see, there's a lot of so many stakeholders. Where are the engineers? There are so many stakeholders who need to really come together to discuss how WASH and health should be aligned, so that we can have a framework that actually is effective. Because it's not just saying, okay, we want to align WASH and health and we leave it for health. We still need that cross-sectoral collaboration, because there are competencies that are not in health, but which we need to be able to make sure we increase access to WASH services in health. And I also then want to talk about policies. The policy environment needs to really be facilitated. And that means that we should have WASH in all policies where applicable, WASH in all programs where applicable, and WASH in all sector, you know, interventions where applicable. And usually also when we go to our high-level meetings, we are talking a lot of political and strategic leadership engagement, but we need to also realize there are various levels of leadership that need to be engaged. So all the levels of leadership are also important, because the flip side is if you just talk everything technical, then you don't have the political leadership that will actually give, you know, a push to WASH and health. So I could have gone on, but Vida has signaled me that I need to wrap up. So I'll leave the rest to Kofi to reflect on. Thank you so very much, and over.
Thank you so much, Mary. You could have gone on, but we'll leave the rest for all Systems Connect. If people want to hear more, they should come, and then we'll continue with the conversation. Thanks so much for the great insights. For me, what I picked is that within the health system, WASH is health. So we shouldn't even present it as if the WASH, the people in the health system are not aware of the interconnection. It's not like asking to be part of it, but more of how we can better align and engage. And thanks so much for all the reflections. We'll hear briefly also from Kofi Abraham, who is from PATH. PATH is one of the main organizations supporting the WASH systems in Ghana. Most of the things that they do support improvements in WASH IPCs within our Ghana Health Service. So Kofi, can you share a little bit perspective on the issues that you have heard and how you see your work in promoting some of the issues that Mary and Lindsay have highlighted?
Thank you very much, Vida, and thank you for your presentation, Lindsay, and Mary for your reflection. I'd like to speak more from the perspective of an implementing partner, just to see how we can link, you know, WASH and healthcare. I think Dr. Ashina has already alluded to the fact that, you know, WASH and healthcare, they go together. You can't provide quality health services if you don't have the adequate or appropriate wash services going with it. And, you know, there are various levels in the health system that for us as implementing partners, we see entry points for making these linkages. And I'll start, for instance, from the national level. First of all, we need to, for instance, ask ourselves, where does WASH sit within an institution like the Ministry of Health? Can we have a clear idea or clarity on who is in charge of WASH in the Ministry of Health? In Ghana, for instance, we have the Ghana Health Service. All these institutions need to come together and provide a better, picture or clarity on who is taking care of WASH when it comes to healthcare services. And in addition to that, you also want to look at, supporting at the national level. You want to support the, development of guidelines. You want to look at things like supporting the implementation of some of these guidelines as well. So at the national level, these are some of the things we want to look at. How do we also introduce the WASH conversation in all our healthcare, fora that we have? And here, for instance, it was mentioned in your presentation, Lindsay, and Dr. Ashina as well, that WASH is very broad, right? But it almost seems like when it comes to WASH in healthcare facilities, is limited to healthcare professionals. But how do we broaden the conversation so we bring other professionals into, WASH in healthcare facility program implementations and stuff like that? And I'm happy to actually hear Dr. Ashino talk about the patient safety conference that we have in Ghana every year, where WASH is always a highlight, no matter the theme that's being used globally. WASH is always part of what we look at when it comes to patient safety and quality of care improvement and stuff like that. So who are the professionals we need to bring on board? How do we support the development of guidelines and policies and things like that? And how do we support the implementation of these guidelines? Also, when we develop these guidelines, how do we replicate, or when we implement these guidelines, we need to look at creating a model that we can replicate across different areas, because we can't move in, at a go and try to bring quality improvements across board, but we need to take it a step at a time. And these are some of the things that, you bring up in WASH conversation. So we create model systems that we can replicate across board. So that basically looks at, the entry points at the national level, trying to bridge or link the gap, or link WASH and then health care. Now, at the sub-national level, for us implementing partners, we think about things like, creating tailor-made solutions for specific areas. I mean, when you go to different areas, Dr. Shino just gave an example of why a wash system was provided and a community, so to speak, was rejecting it, even though you would see it as something that they actually need. So we're looking at bringing tailored solutions, down to the healthcare facility. We need to know what exactly are their needs and to tailor, the projects or programs that we bring down to them. So, for example, you want to look at supporting the region when it comes to the sub-national level to put in the right infrastructure, right? And you want to bring in capacity building programs that will also provide the right knowledge and skills for health workers to actually apply this infrastructure to improve the quality of services they are providing. You also want to look at the peculiar needs of certain areas. Are we looking at an area where they have the risk of outbreaks of certain diseases? This kind of information or this kind of knowledge helps you to build the right kind of systems that will not only support that will support the facility or that area to provide quality wash services on a daily basis, but also in the case of an outbreak, are they going to have the infrastructure, the knowledge and skills to be able to use, to counter such events? And apart from an outbreak, we're also looking at natural disasters that happen that compromise the wash systems or the quality of wash systems that are available to communities and especially healthcare facilities. Are the right infrastructure available and are the skills also upgraded to the point where they can, adequately provide services in such situations? So one other thing that I think has also been highlighted is robust data. Is there the data that provides you the baseline or provides you with the information to be able to direct your investments in the right way? These are some of the things that we think of as implementing partners. Finally,
thank you. Okay,
I'll just round up now, Vida. Finally, we also need to, listen to the health worker. At the end of the day, they provide these services. They are in these healthcare facilities. You want to know what their real needs are. Are they anxious about, the kind of infrastructure they have, so they are not able to provide the service to the level or the standard to which they need to provide them? What are their specific needs? And what are the implications of these challenges to the services they are providing? So from an implementing partner perspective, these are some of the things that we see as entry points to linking, wash and healthcare services, in general. Thank you very much.
Thank you, Kofi, for sharing the perspective of the implementing partner, and then also further unpacking how we can operationalize it at all levels, building on the discussions on the entry point. We'll quickly turn to the participant. Now we have over 70 online. And please post your comment in the chat. We may not be able to discuss everything, but we would see as to address as many as possible. And then we take the rest to all Systems Connect or continue the conversation within the team. We would like to turn to one participant who has volunteered to open the floor with the conversation. So either post or you raise your hand to speak so that we hear your voice. So we would call on Yale Gelman of, now this word is big, Schistosomiasis Control Initiative. Now we are getting into health, so we have to learn how to use the technology. I don't know if Yale is still with us to share perspective or ask the question. Let's try to be short so we can get opportunity for others to also speak.
Thanks so much, Vita and Lindsay. And just to say, we've made your life easier. We actually rebranded a week ago. We're no longer called the Systems Control Initiative. We are now Unlimited Health. So yeah, just a quick remark from someone who used to work in the wash sector and I've now switched over to the dark side of the neglected tropical disease space. Just one reflection, I really agree with the entry points that are covered in the position paper, and I think disease prevention programs are a really important entry point. However, we need to keep in mind that in a lot of cases, in particular when it comes to neglected tropical diseases, those control programs themselves are not very well integrated within the health system. They're sort of run as vertical programs. So you almost have to do a double effort for integration where you're having to build that into the health system and then also create this space for collaboration with the wash sector. And on that side, I think for me, there are three key barriers, which are also opportunities, as Lindsay has told us. So the first one is that we have very different objectives of what we're trying to achieve. We're trying to control a disease. The wash sector is trying to improve access. So the first step for that would be to find shared objectives that we're all trying to reach. And then the data that goes with that. So a very specific example and something that's been happening in quite a few countries is using the data on disease distribution to inform allocation of wash resources. So that's one point. The second point is, it's not very obvious the different institutions will want to work together. Doctors and engineers don't always speak the same language. We know that already. So in quite a few countries that are trying to tackle a very high burden of neglected tropical diseases, we're seeing very successful models of forming formal coordination bodies that bridge across those sectors. But then the final challenge is the one that's actually the hardest to deal with, and that's funding. When you've got different budget lines and you're held to a very different kind of deliverable list, it's very difficult to use your budget flexibly. So for schistosomiasis or bilharzia, if that's easier, most of the funding is allocated for mass treatment, and there's very little fiscal space within the program for doing wash activities. So this is really where we've got to educate funders, and we've got to create fiscal space within the health system for supporting coordination and funding those crucial activities that cut across the two sectors. So I think in summary, we're getting there in some areas. There's some really helpful guidance from WHO that I'll post into the chat just to encourage people that it can be done. But I think we always need to deal with the root causes if we're going to get the two sectors to work together. Back to you, Vida. Thank you.
Thank you. Thanks for those perspectives as well. We'll still have it open. This is the time for the participants. So if you'd like to speak, raise your hand. But I'm going to ask Lindsay to check in the chat because I saw some comments and questions coming up. So if you can please pull a few for us to reflect on as well.
Sure. There's one question in particular Ahmed has posted here, really about whether there's an online space for a community of practice, something where people can come together to continue this conversation. And the answer is kind of. I mean, of course, I run the Washington Healthcare Facilities Community of Practice. That might be how some of you ended up on this call, but that's, specifically looking at the context of the health facility. And I think the conversation we're having here is broader, right? It's about that relationship broadly about wash and health and public health. So there have been efforts, the PATH actually, the group that focusing on diarrheal diseases had put together a group that was looking at wash and health and from an advocacy perspective, and that is now run by Core Group. But it sort of feels like there's not one central place for us to carry this conversation forward. But maybe that doesn't need to happen. Maybe it should be more integrated into the health space. I think that for me is one of the questions I pose to you all and to our health colleagues. What would be the most effective space to come together to carry these forward? Is it working through individual spaces like the NNN, which I saw that there was some, Yale just dropped the link into the chat. Or is it that we need to create space? I don't want to make anyone's life harder by another task force, but how do we make this coordination effective from a global conversation perspective? And then you all, I think, carrying that forward at a national or subnational level also. There's also a couple other, I don't know if anyone's raising hands yet, I don't see it, but I do see a question here from Mark actually about whether or not panelists feel there are common professional system leadership challenges. So I think this could be a question we could pose to Mary in particular about whether or not there are behaviors needed across sector leaders that we could help push forward. And Mary, you kind of sit as a WASH leader and a health leader. Mary, if you still with us.
Yes, please. So yes. Thank you very much, Lindsay. In fact, when the previous speaker was speaking, the first thing I did was to circle leadership, especially where she spoke about health people thinking beyond health, the traditional health professionals, and bringing others on board. And I remember that during the pandemic, when we were conducting training across the 16 regions of Ghana, we had to draw a plan to attach. And each plan, each region has a lead facilitator and a co-facilitator. To be able to empower the regions themselves, the co-facilitators are the regional focal persons. So there's one region where I sent an engineer, and then the regional director quickly called me and said, Dr. Shinyoba, we thought you were sending a nurse to come and teach us WASH. And I was like, yes, this person is an engineer. He's not coming to your region to come and give injections, but he's coming to train your people how to create health systems within which your nurses can then give their injections. And we both laughed. And that says how much, you know, even at the highest level, people still think that once it is anything health system, it should be the traditional health professionals that we know. So it is a mindset that we have to drive, and it's a leadership function. It's leadership that can actually create that change. And it's not management, it's not the traditional managerial roles, but people who are able to, you know, drive some inspiration and change of mindset and doing things differently to get the results we want. And maybe we should begin to look at a leadership program for WASH, or a leadership program for bridging WASH and health, or a leadership program for aligning WASH and health. And that could be a platform that we can mobilize health leaders, WASH leaders coming together, understanding each other a little bit more, sharing their perspectives a little bit more, and then identifying common, common goals, you know, or common destinations where they can, the two sides can then work towards. But the reality is that most of these, you know, thinking or decision making is driven by the funding or the perceived funding that comes with WASH, you know. So it's also important to understand the software issues, because health system is not just hardware. It's not just supply these logistics. And then if you supply hardware, it doesn't translate to high quality. It doesn't translate to safety. It doesn't translate to disease prevention or resilient systems. But those hardware are actually input that will go through a process. And really the critical thing that translates those hardware is the software components. So understanding what different groups' perspective are and where they can be assured that their interests, you know, are well catered for, and they are all part of the bigger picture. I think for us, it's been one of the things that has helped. It's not been easy, but we are still trying, and it's a journey. Thank you.
Thank you, Mary. I think on this note, we would have a good appetite to all come to All Systems Connect. So I'm going to ask Lindsay to say a little bit about the All Systems Connect, particularly the session on WASH and health connection, and so that we would bring our discussion to a close.
Absolutely. And it's exciting to me to see all of the comments in the chat box. I'll certainly come forward with some of those thoughts to hear from you all. In some ways, it seems that the challenges we faced before COVID are the same challenges we're facing after COVID. WASH has not been as integrated as we had hoped, but in other ways, I think we are identifying some of the opportunities and ways forward, which I think is really important. And so that brings me to All Systems Connect. For those of us who are able to join in May in The Hague, there will be a Connect Health stream. There'll be 7 sessions. I've listed 6 here because 2 are on the same topic, but we're going to have a plenary and a workshop that talks that first entry point, robust, high quality health systems through WASH. We'll talk from a very high level, and then we'll actually be able to get into what programmatically, what implementation actually looks like when you do this work. We'll have a session on WASH and healthcare facilities, of course, thinking about some of the comments perhaps that you made in that in the chat, Peter, about how do we get our medical colleagues to see that this is important, that this is something they value and prioritize, that this is not an optional component of a health facility. We'll have a conversation around climate smart wash and health agendas and where these two overlap. What are the opportunities for moving forward together on climate resiliency and mitigation in health, not just healthcare facilities, but of course, in communities and other contexts where the lack of safe wash services will impact the health outcomes of the populations. Thirdly, we'll have a session, or fourthly, we'll have a session on gender and wash and really talking about the role of women and girls in helping develop these solutions. We know that women make up the majority of the health workforce. Women and girls are using healthcare facilities for certainly very serious delivery services, for example, bringing children to the health facility. So they need to have an important say in what those wash services look like. We must elevate their voices. So we'll have a conversation about what that looks like. Some of our partners actually on this call are going to be involved in this. Yale Velman, Yale, I missed the new name of your organization. Schistosomiasis Control Initiative is the past tense. Your new organization is stepping forth and talking about what does WASH working for disease-specific programming look like. You made a conversation about these vertical programmings. Be interesting to hear about how that works. What are some effective strategies we can use? And how do we continue to push a system strengthening lens through that effort? And then lastly, we all know that next week is the UN Water Conference. I apologize for many of you. Vida's flying tonight to this. Thank you for talking to us today. But there will be an interactive dialogue on water and health. And I'm interested, as I'm sure everyone else is, what does that mean? What do we take away from that and where do we go? So really, I'm excited to carry these conversations forward. The purpose of today was to present to you our entry points, our vision on this based on a number of conversations with you all in the community and our health colleagues. And then starting in May, and hopefully you will be there with us. If you haven't, there's some, haven't heard about it, there's some links in the chat about how you can learn more. We'd like to start the conversations about what this agenda could look like. And we invite you along on this process with us to really identify and take some of these great ideas we're hearing here and help push this forward so that greater alignment is possible. And actually, I think I might start using that phrase that Mary said, realignment. We were at one time aligned and we have since stopped being aligned. So let me just share one last video with you all. I apologize, I have to switch screens. We're gonna go ahead and I'll share this video of All Systems Connect, get you all excited about this. And then I will turn back to Mary to set us free. So hopefully that has everyone energized and ready to come join us in The Hague in May. Mary, Vida, back over to you.
Thank you very much. And thank you all for those stimulating ideas and sharing of experiences. We'd like to thank in particular our resource persons today, Lindsay, Mary, and Kofi, for sharing your perspective and stimulating us for All Systems Connect. And not just for All Systems Connect, but beyond that, how we will continue to realign to achieve and maximize the impact that we all aim for. We'd like to also thank all of you for the time with us, sharing your perspective and continue to put your ideas in the chat. But until then, let's continue with the dialogue and let's connect at All Systems Connect and continue with these big ideas and experiences. Have a good evening, have a good afternoon, have a good morning wherever you joined from. And we'll see you again. Bye-bye.
Thank you. Have a good day.
Thank you. Bye.
Bye.